समरकंद स्टेट मेडिकल यूनिवर्सिटी में जो उनके वहाँ पे एनाटॉमी के हेड ऑफ डिपार्टमेंट है कलीम रज़ा सर, वो उनके साथ मेरी वीडियोस है और वो उन्होंने डेमो क्लास में अपने स्टूडेंट्स को लेके गया था, उन्होंने डेमो क्लास लिया था बच्चों का। मैं भी देखना चाह रहा था कि इनका जो बच्चों को जो पढ़ाने का पैटर्न है किस तरह का है, क्योंकि मैं बहुत सारी यूनिवर्सिटी कंट्रीज़ में गया, बच्चों वहाँ देखा, उनका क्लासरूम वगैरह लेक्चर्स वगैरह को देखा, तो मैं ये देखना चाह रहा था कि ये किस तरह पढ़ा रहे हैं। लेकिन मुझे काफ़ी अच्छा लगा क्योंकि एनाटॉमी के काफ़ी स्टूडेंट्स बता भी रहे थे कि सर काफ़ी अच्छा एक्सपीरियंस है सर के पास। और जो मैंने डेमो क्लास भी देखा, सर ने काफ़ी अच्छे से मतलब 3D में इसमें बिल्कुल जो डिजिटल उनका जो बोर्ड था उस पर उन्होंने इसमें पढ़ाया बच्चों को और दिखाया किस तरह से वो आगे सिलेबस को कवर करेंगे और पढ़ाएंगे, किस तरह से स्टडी मटेरियल देंगे, नोट्स देंगे आपको। तो ये वीडियो में आप देखें कि जो सर है वहाँ पे एनाटॉमी के हेड ऑफ डिपार्टमेंट हैं डॉक्टर कलीम रज़ा साहब, रज़ा सर, वो काफ़ी वेल एक्सपीरियंस है वो सर। और उनकी वीडियोस जो है हमारे साथ हमने उनके साथ ही शूट किया था, ताकि जो स्टूडेंट इंडिया में समरकंद स्टेट मेडिकल यूनिवर्सिटी में अगर फैकल्टी के रिगार्डिंग उनको कुछ डाउट्स है तो आई थिंक ये वीडियो उनके लिए काफ़ी हेल्पफुल होगी।
And then we have added, lot of mock tests. Lot of mock tests of not just basic subject, but in addition we have added the clinical subject mock tests also. Here you can see the list of mock test subjects, and these are quality questions. These are real exam, and suppose you are enrolling in this, Chinar multiple subject test. So you will have, in some tests 300 questions, 100 questions, 50 questions. You can skip if you don't have basically, correct statement in your mind. And at the end, you can again, basically choose that statement to answer that question. We have added clinical pictures also. Scenario based questions also. We have added x-rays also, that you are dealing with the bones, that we will study the bones of the appendicular skeleton, bones of hand, bones of upper limb. But important thing that if anyone is having fracture of this bone, yes, how you will find on x-ray that which bone is fractured or which part of bone is fractured. So who will answer? What is the name of this bone? Any one of you please? Who will answer? What is name of this bone? So you can see these are the bones of hand, yes? So suppose these are bones of your left hand. So you can see these are the carpals, yes? 18 number. And this is a bone, the marked bone is this one. This is called as capitate. This is called as capitate. So this bone is capitate, okay? This bone. So if you are learning just from the textbook, just by pictures, or reading the theory without exploring the structures and then applying your knowledge on these radiological basically diagnostics, it means you are not basically preparing yourself to work as doctor on bedside. There are a lot of students, those who are having plenty of knowledge, but that knowledge is not applicable knowledge. The knowledge which is required to become a successful doctor or to pass any exam, that is highly applicable knowledge. So most important question that you have to ask yourself, that what to learn and what not to learn. You understood? This is not possible that to learn everything. But once you know what to learn and why to learn, then you will be having plenty of knowledge, the knowledge that is required to pass exam and to apply knowledge in clinical life. So this bone is a different bone. You can see this is other bone now. So this is this bone. This is called a scaphoid. This is your scaphoid in snuff box. Here this bone is the scaphoid bone. Platform with the name of Chinar Medicos. Yes, This is your platform because you are going to study the human anatomy, biochemistry, and then physiology, the basic disciplines. When you are starting your MBBS school, first it comes the human anatomy, that you are going to explore your body. Yes, anatomy is all about dealing the structures of human body. Nowadays you have got lot of technology tools like 3D structures. So this is complete structured educational platform. Why I am calling this structured platform? Because we have not just added the video lectures. I will give you the examples also. In addition, with each lecture we have added real exam questions, and with the questions we have added the high yield notes, the nutshell, the bottom line of each and every topic. Suppose you are starting from first semester and you are dealing with the bones, and suppose you are learning the head and neck. Yes, so if you are watching the lecture on the skull, you will simply type here the skull. In search bar you will type any topic and then you will find here. So skull, then you will enroll, you will get access to the video lecture. So here you have a video lecture. So you will watch the lecture and you will make your notes. Yes, it means that why making notes is important, because you have your way to preserve this knowledge into your brain, to your memories. Yes, it will help you to retain this information maybe after 6 years when you are sitting in MCI exam or in any other exam. Yes, and then what was the level of concentration during watching this lecture? You can evaluate your performance, and you can evaluate your basically performance of your IQ level by solving the exercise question. That suppose you are dealing with the skull. Now you have to solve few questions. There are exercises with the 5 questions, some topics having more than 20 questions, 15 questions. It depends on the quality of basically that specific lecture, that why this is important and how many questions are important, the high yield content. Yes, so you will solve these questions, then you will submit. Here you can find that it will give you the results, that this question, that suppose vagus nerve passing through which foramen, so it's passing through jugular foramen. So you can get your results also instantly. And then you have got with the exercise you have got notes also, like notes by professors, like here you can see these are the notes for one topic, that is the brachial plexus. So you are watching the lecture, then you are solving the exercise question, and at the end this is like for your rapid revision. This is called as the final call, the last moment revision, because you have to study in coming 6 years not just human anatomy, but you have to deal with other subjects also, lot of clinical subjects, like there will be 20 major medical subjects in entire this 6-year journey. And the important thing that you have to keep an eye on your destination, that how you are going to learn in coming 6 years. And 6-year journey, 6-year knowledge of 20 major medical subjects, your condition will be assessed when you are sitting in examination hall conducted by your medical council in your homeland just in 6 hours. So 6 years, 20 medical subjects, and you will be assessed just in 6 hours. And then after passing that exam, you will have license and registration privileges from your medical council, that you are having plenty of knowledge and now you are safe for your community member and you can work as physician doctor. You understood? So this is why we have added these basically high yield questions, high yield notes, in order to have last moment review.